There is now a record high number of daily COVID cases in Ontario, and we haven't hit the peak yet. But hospitalizations aren't expected to explode. This is a good news, bad news story, and let me first tell you about those record high numbers.
We estimate right now, based on our triangulations from wastewater, that we're approaching about 100,000 cases per day.
That's right. He said 100,000 cases a day, and it could be as high as 120,000. When the science table presented its last set of modeling last month, Juni says it was based on people keeping the same behavior and limiting contacts. But that hasn't happened. And here is the result. This was the wastewater graph from March 17th. Compare it to Ottawa's current wastewater graph.
The challenge is now really just to figure out, given our immunity, if the behavior just stays as it is, where the peak would be.
So that's the bad news. But now for the good news. Even though hospitalizations are up by 38% in the past week, Juni does not expect them to skyrocket to over 4,000 the way they did in January because of a wall of immunity from third doses and the estimated 4.5 to 5 million people that have already been infected by Omicron. But Juni warns the province needs to slow infections down.
We're generating a tidal wave right now. It could still become very challenging.
The provincial government has shifted from fighting the pandemic to managing it. Both the Premier and the Health Minister have maintained this week that COVID is manageable despite the rising cases.
We can handle this.
There's no cause for panic, that this was anticipated.
Juni would like to see stronger masking recommendations and notes soon the weather will be warmer. People will spend more time outdoors and the risk will go down.
Just a few weeks, take it slow, mask up again. We, in combination with the immunity we built up, will be able to sort of model our way through it. No? If we continue, then we just will strain our healthcare system.
Now, fourth shots will be offered as of tomorrow to people who are over 60, as long as 5 months have passed since the third shot. The science table is working on new modeling and it should be out soon. The key, though, here is for people to be aware of these numbers. Yes, 100,000 is frightening. For many, COVID is just a cold or a flu, but for the elderly, the unvaccinated and immune compromised, it can be serious. They need to know their risks.